I decided to get the vaccine because I wanted to be able to serve my patients and be on those front lines and not be afraid. Also, I've not been able to see my family and my friends for so long. And even with my mask and the hand sanitizer, I needed to make sure I was using every tool within my power to protect them. Yes, I recommend the vaccine to all of my patients, even if you are a woman of childbearing age, if you're pregnant, or even if you're breastfeeding. This is so important because there's a lot of unknowns about the vaccines. We have more work to do to study them, but we know that coronavirus is very dangerous, especially in women who are pregnant and especially in women who are breastfeeding and taking care of young children. Also, young children cannot receive the vaccine yet. So because they cannot receive the vaccine, it's up to us as adults to make sure that we're getting vaccinated to slow the spread. So far, there were people in the vaccine trials that were not pregnant when it started, but they did get pregnant at some point, and there have been no complications for them. People who are in the community who have received the vaccine under the emergency use authorization have not had any reported side effects that we know of so far. There have been historical concerns within minority communities about receiving the vaccine. If someone has a concern, I think they are valid in having questions and also looking at historical issues. But the important thing is that right now, we use facts and we also have conversations with our provider to dispel any myths. There's a famous quote, "When America catches a cold, Black America catches the flu." What we do know right now is that minority communities have very high rates of infection, and that's increasing our rates of hospitalization and death. Right now, the best tool we have is the coronavirus vaccine. So until we know more about the vaccine, we won't be able to answer all the questions, but this is the best protection we have right now. If I could dispel one myth about the coronavirus vaccine, it is that the vaccine actually gives you the virus. That myth is not true. What happens with our vaccines is we are helping the immune system get prepared for when it does encounter the virus, but there is no coronavirus in the actual shot. It's just preparing your immune system for when it may run into coronavirus. One thing I'd like to remind people of when they're trying to decide if they want to get the coronavirus vaccine is we always want to weigh our pros and our cons. But in this situation, we're weighing the risks of the vaccine with the risks of coronavirus. But what we do know is that coronavirus has a lot of risks, and many of those include death, and not only to us, but our family and friends. So when we're talking about the risk of catching the virus, we're talking about the risk of catching the virus and sharing it with children, elderly people, and our loved ones. So those are the risks that we need to weigh if we're trying to decide whether or not to get vaccinated.